Hey guys, did you know that intrauterine devices and implants are the most effective methods of family planning? Well, in today's episode, we're going to discuss about the different types of contraceptives. We have the two types of contraception, that is the hormonal type and the non-hormonal type. The hormonal type has the combined contraceptives and the progestin-only contraceptive, and non-hormonal contraceptives are the ones that do not alter your body's natural hormones. My name is Benta. Welcome to Benta Media channel. If you are new here, kindly subscribe, turn on the notification bell so that you cannot miss on the next episode. Comment, like, and share if you find the video educative. We have 6 types of contraceptives which are commonly used in the society by women of reproductive ages. 1. We have the implant. 2. We have the intrauterine devices. This one comes in 2 types. You have the hormonal one and the non-hormonal one. We have injectables, which comes as depot. We have the daily pills. We have the lactational amenorrhea. This one applies to women who are exclusively breastfeeding. We have the barrier method, which includes the CDs. We also have the fertility awareness. This comes with what we commonly refer to as safe days. On to our first one, which is the implant. Implant is a form of contraception that can stay in the body for 3 to 5 years, depending on the choice of the consumer. It being a small device the size of a matchstick, it's usually placed under the arm. At first, we said it's the most effective method of family planning because once it's placed under your arm, you don't need a reminder on when to take it again unless the 3 years or the 5 years, depending on your choice, elapses. Some of the well-known side effects of implants include headache, fatigue, spotting, mood swings, and even weight gain or weight loss. It works by producing progestin, which thickens the cervical mucus, hence preventing the sperms from reaching the egg. 2. It prevents the ovary from producing the egg. Still, this one helps in preventing pregnancy. On to a second one, the IUD. IUD is the intrauterine device. It comes into 2 ways. We have the hormonal type and the non-hormonal type. Before we continue with the discussion about the 2 types, I've heard of myths concerning the IUD. Like 1, will your partner feel the IUD when you are having an intercourse? The answer is no, because your gynecologist will place the intrauterine device into place such that it's nowhere to be felt along that canal. 2, if you can use tampons while you are using the IUD, yes, you can, but you need to be very careful not to pull the thread of the IUD when you are pulling out the tampon. Another one that I've heard is that the IUD will bring you heavy menses, will bring back pains. Yes, these ones are there, but they are not long-lived. They are short-lived. If you have the cramping pain after the insertion, you can actually get some over-the-counter painkillers. If you are having the bleeding or spotting, unless it gets worse, I would advise you remove it. And if it doesn't, you can just control the bleeding by going back to a gynecologist and getting the best advice from them. On the hormonal contraceptive type of IUD, this one you need to get it within the first 7 days of your cycle, because the cervix is opened, hence the pain will not be much, and also you are guaranteed of protection since you are on the safe days of your cycle. 2, if you get the IUD in the days that are not within the 7 days, then you need an extra barrier so that you cannot get pregnant out of it. The IUD works by producing progestin, which makes the cervical mucus very thick and also prevents the egg from being produced from the ovaries. The hormonal contraceptive IUD can take 3 to 6 years, depending also on your choice, and every period can become lighter when you are on it. If you are so sensitive to the hormonal contraceptives, then the hormonal type will not be your cup of tea. You can switch to the non-hormonal type of contraceptive, the IUD one. With the non-hormonal IUD, it is the copper T. Copper T works by mobilizing the sperms, hence they cannot reach the egg. The copper T is a bit expensive than the hormonal type of IUD. It can last up to 10 years. It comes in types of the Mirena. Onto other type of contraception, you have the Depo-Provera. This one is a type of injection that is given within 3 months period. So if it works well for you, you can be getting it after every 3 months once they elapse. Depo-Provera has its own side effects. Some people complain of weight gain, others complain of spotting, heavy bleeding, or even lack of bleeding at all. This is because when you are on Depo, you don't get ovulation. Because as you know that Depo works by producing progestin, which also prevents the release of egg, and again also thickens the mucus. There are people who work perfectly with Depo such that they don't even get those side effects of bleeding or spotting. Actually, they get their menses normally, they don't even get the headaches, which is also perfectly well. As we started the video, we said you go for what perfectly works for you. If you have never used Depo and you don't know how it works, and probably you want to conceive immediately after using it within the first 3 months, then also I'll advise you not to use it. Depo can delay the ovulation period, and even it can delay it up to 1 year or even more than 6 months, whilst others don't get all these side effects. On to our fourth type of contraception, we have the daily pills. The daily pills comes as a pack of 21s or even as a pack of 28. With this kind of pills, you get the active pills are only the 21 pills, and the rest 7 are only used to keep you on track, and they are non-hormonal. The advantages of these pills: 1, they control acne; 2, they control the premenstrual syndrome; 3, they try to balance hormones for those who have irregular menses. The only disadvantage with these pills are that are not for the forgetful ones. In such a cases that if you miss some pills, you may become pregnant. 2, they can have drug-drug interaction on any other medication. Myths associated with the daily pill that I've heard of is: 1, can I skip the pill if I'm not having any intercourse? My answer would be no, because these pills are designed in a way that they work by you using daily. If you skip these pills, you'll miss the track and possibly you get pregnant. Another myth that I've had concerning them is that some people complain of gaining weight or losing weight. Yes, that's so true. Some people gain weight. If you gain weight when you're using the hormonal pills or hormonal contraception, is mostly because of fluid retention and also increase in muscles. Also, you can get an increased appetite, especially if you're using the combined pill. So this one will make you gain weight. On to our fifth type of contraception, I'm going to talk about the barrier methods. These ones include the use of spermicide, the use of CDs, the use of the diaphragm, and many more barrier methods. These ones come in handy if you're using the fertility awareness method, which means you are using the counting of safe days and the unsafe days. So for the period that you know you are unsafe, you can actually use the barrier methods like the spermicides, whereby the spermicides work by thickening the cervical mucus. Just as we talked before, this one prevents the sperms from reaching the egg. Also, the use of CDs prevents the sperms from reaching the egg. For those who are using purely the fertility awareness method, you also need to be very well conversant with your menstrual cycle, such that you know the days that you are fertile and the days that you're not fertile. For the days that you are fertile, I would urge you to keep on track changes on your vaginal mucus, so that when it's much, or when you tend to find that it's a lot, or maybe you get the spotting, then you know that you are about to ovulate, or maybe you are ovulating. And you also need to have a constant lifestyle. So don't be that person who has spontaneous kind of lifestyle, because this one can change the way your cycle behaves, and hence you'll not be able to track your safe or unsafe days. On to our sixth method, we are going to talk about the lactational amenorrhea. This one refers to the lack of ovulation during this period of breastfeeding, but this one is for the mothers who are doing it exclusively, such that they are not giving their babies formula, they are not feeding their babies, they are only breastfeeding them during day and night. This one can be a very, very good method of contraception for them. With the lactational amenorrhea, if we are not doing exclusive breastfeeding, then you can try the progestin only pills, so that this one will not hinder the amount of breast milk that the baby is getting, or it will not cut short the production of your milk. Lactational amenorrhea works in a way that when the prolactin levels are high, these are the hormones that are responsible for milk production. They make the follicular stimulating hormone and the luteinizing hormone not to produce eggs, hence there will be no ovulation during this time. And also, I've noted that some mothers tend to get periods even before 6 months, and they are actually doing exclusive breastfeeding, then this is no problem. Mostly this is called an ovulatory period. This is no problem because during this period the fertility levels are very low. Thanks so much for watching. If you enjoyed the video, kindly like it, subscribe and turn on the notification bell so that you cannot miss on our next episode. We'll be talking about teething in babies. Thank you.